Hello, welcome to the Old Fashioned Health Network, good health inside and out. I'm Dr. David Lee, host of the Medical Show. Today we're going to talk about painkillers, overuse, underuse, a little bit about all of the above. I can tell you what I know about good, healthy people. If you're 80 years old and you're healthy, you have three things in common. 80-year-old people that I see that are healthy have three things in common. They have good teeth or good false teeth. They don't have a mouthful of crowns, bridges, and root canals because those things breed a whole bunch of bacteria and they take a lot of high maintenance to get through the day. Good teeth or good false teeth. Number two, they have God in their life. And it's not always the same God, by the way, but they have God in their life and they have a high belief system. Number three, they don't take a handful of over-the-counter and or prescription drugs every day. They have finally figured out somewhere between the ages of 60 and 80 that they need to modify their life drastically, for most cases, to get off of all those other crazy medications. That's what I know about healthy people. I read something to a couple group of my patients the other day. We wrote it down and sent out an email, and I'll read it to y'all. It says, it's often true that drugs are faster acting, instant gratification. That's true. People confuse because I do alternative stuff, and I'm a functional medicine, and I do chiropractic and those things. And so you go, oh, that's great. I go there when my back hurts. And I go, no, you're wrong. Medicine is the best way out of pain. Morphine stops pain so fast you barely have to inject it before the pain stops. The best way out of pain is medicine, instant gratification. But it doesn't get rid of the reason you're in the pain. The best way to go to the chiropractor, the best way to use some alternative medicine would be to equate it to your car maintenance. If you go and get your oil changed, get your tires rotated, get the brakes checked every once in a while, get a tune-up when the car says you're supposed to get a tune-up, that car will service you for many, many miles, is longer than the manufacturer probably recommended. You treat your body the same way, the same thing will happen. If you wait until you're hurting, then you're going to depend on all kinds of things. Then you're going to curse the alternative medicine people because you're going to say, wait, I came in to see you to get my back fixed because my back hurts, but I waited for 5 years. Now it might be a surgical indication. You see what I mean? So let's don't compare apples to apples and oranges to oranges. If you're going to do alternative medicine, do it because of maintenance. Don't do it because of after the fact. After the fact, the emergency room might be your best option. It's often true that drugs are faster acting. Instant gratification sometimes, but, for example, I did a little Google search. Motrin and Aleve are abysmal failures as far as painkillers. Why? People are going to take those even if they have pain because they think, what? It's not going to hurt me. It's just a little Motrin, just a little pain relief, right? And here's why. There are alterated cancer-causing ingredients. Let me read you some of the ingredients that are in there. Compounds like marilate, lactose, sorbate, sucrose, inositol, FD&C yellow number 5, FD&C yellow number 6, FD&C red number 3, red number 40, blue number 1, blue number 2, green number 3, and a limited number of D&C colorants and iron oxides, all of which have been found to be cancer-causing agents. And those are all rampantly found in things like Motrin and Aleve. Those are not good, especially if you're taking one on a daily basis. Sometimes people say, take one every day. It won't hurt you. Well, there's a cumulative effect of all those little nasty dyes and the additives that are in these things. But the drugs are part of a clique today. Deadly products like aspirins, right? NSAIDs, non-steroid anti-inflammatory drugs. Just remember what you can quote Dr. Lee. Remember this? You ready? Aleve leaves what? Well, think about it. Aleve leaves a body count. That's what Aleve leaves. It doesn't leave no pain. It leaves a body count. I Googled it every year. I underestimated it because 7,600 deaths and 76,000 hospitalizations are in the United States for things like aspirins, Motrin, and Aleve. 7,600 deaths, 76,000 hospitalizations because of these over-the-counter things. Which one do you want to do? Do you want to do a little maintenance? Get your oil changed, get a tune-up, go see your alternative provider for maintenance care, or you want to wait until you have to go to the emergency room or to the drugstore at the midnight drugstore and get something that's going to cause you cancer or other issues. If you're following the protocols that we suggest, you can avoid all these over-the-counter things and all these drugs and high-powered potencies. Do a little Google search on your own. Look up the ingredients and see what the effects are. I have it happen to me every day where patients will come into the office and they'll give me a list of the medications they're taking, and then they'll give me a list of their symptoms. So usually one of the first things we do is we Google the side effects of the medicines they're taking. And guess what you find? The side effects of the medicine they're taking are the same things they list as their symptoms that they're having, the reason they came to see me in the first place. Now what would have happened if they had done some maintenance first? They wouldn't be on the medication, they wouldn't have the side effects, and they wouldn't need to see me anymore. That'd be okay, wouldn't it? Be okay for you, it'd be okay for me. There's plenty of people that won't follow our directions, so I have plenty of business. I'm not worried about that. What I'm concerned with is educating people until they understand that we create our own things. I had a lady in here just an hour ago her right hip was, quote, killing me, doc, it's killing me. And I said, it's self-inflicted, because we did all of our testing, all our evaluation, things like that. And ironically enough, the right hip shares some of the nerve supply with the stomach. And she just came back from a 22-day cruise, eating everything that she shouldn't have eaten in her entire life. And she said, oh, but the food was good, the scenery was great, the company was awesome, it was just a beautiful cruise, we had a great time. I said, I'm grateful, I'm glad you had a good time. Sorry I didn't get to go with y'all. But the pain in your right hip is self-induced. You don't have a bad hip, you don't have degeneration, you don't have arthritis, you've got a nerve supply to the stomach that's going, I hate you for what you've been feeding me. She'll be home for 3 or 4 days, she'll go back to her good diet, and guess what? The hip pain will stop. Exciting, huh? So think about that next time you reach for a pain reliever and over the counter. Oh, I'm only taking one a day, it's not a big deal. Add it up and see what you come up with, how many dyes and potions and lotions you're putting in that are on the list of cancer-causing agents that you're putting in your body. And then tell me why later you want to wonder where I have no idea where this problem came from. That cancer came out of nowhere. It didn't come out of nowhere. It came out of self-induced behaviors. Maintenance. Change oil in your car. Do maintenance on your body. Be healthy for life. Dr. David Lee, have a great day.